Well, hey everybody, this is Robert, and welcome to Outbreak News TV. And today, what I'd like to do is go over the stories that was covered on the website Outbreak News Today, and we'll look at the past week. So we'll call this Outbreak News This Week, and these are some of the bigger stories that were covered on the website. And let me go ahead and start with a couple stories out of Mexico. And the first one concerns the state of Chihuahua in northern Mexico. And so far this year, they have confirmed 89 cases of rickettsiosis, to include 43 fatalities. Now, rickettsiosis, of course, is a tick-borne disease. In the U.S., we typically call it Rocky Mountain spotted fever. And so far, they've reported 89 confirmed cases, which is up about 5% from last year. And the death toll is roughly the same. And officials there say, if detection and treatment were carried out promptly, the mortality rate would be practically zero. So that's the big problem with rickettsia, is it's very rapid. It's a rapidly progressive disease. And when you start seeing like the rash, it's at that point, and antibiotic therapy is due immediately. So detection and treatment is very, very important, to be very prompt. So basically, health officials are just saying, this is a problem. This is a problem it's an emerging threat in Mexico, particularly in those northern regions, like where Chihuahua is. Chihuahua is a state just below the U.S. border. And it has, the case fatality rate in this particular situation is close to 50%. The treatment of choice, of course, for this are like a tetracycline, doxycycline. So that's important to keep our eye out on. And we'll keep on taking a look at the situation in Mexico. The next story I want to go to is something a little bit larger, and it's more connected to the rest of North America, particularly the US, and that's the measles outbreak this year. And the Ministry of Health has officially said the case count has topped 5,000. So as of yesterday, October 24th, 5,053 confirmed cases of measles have been reported in the country. And that's not to include the more than 11,000 suspected cases, the ones that are not confirmed. The distribution of the measles has been distributed among 25 of Mexico's states, and 127 different cities have confirmed cases of measles. Chihuahua accounts for the most cases, about 9 out of 10 of them, with about 4,400 cases. And then it's spread out after that. In Mexico, measles began about the last week of January, and it's been a lot ever since. A lot of it's connected to what was going on at the Texas-New Mexico border. There's definitely connections between Chihuahua and that area. Now, one of the concerning things are the fatalities. There's been 23 measles deaths in Mexico, with 21 of those in Chihuahua state alone. And then in the report, I also mentioned what else is going on in North America. Well, Canada has also reported over 5,000 cases, with about 4,700 confirmed, out of most, if not all, of the different provinces. I'm not sure if it's missing any. I have 10 written here. And there's been 2 fatalities, one in Alberta and one in Ontario. And both of those were congenital cases who were born preterm. In the U.S., there's been over 1,600 confirmed cases. The vast majority are from 42 different states, and the remaining 23 cases were reported in international visitors. And in the U.S., there was 3 confirmed fatalities from measles. All right. Another story that popped up this week is the situation with Mpox. We're seeing increases in Mpox in several cities in the past month or so, including Chicago, San Francisco, and New York. But we're also seeing an increase in the Seattle area, King County, Washington. They reported 45 new cases of Mpox. It's clade 2, so it's not the more rare, more pathogenic clade 1. And it says health officials there say that while this 45 cases is much lower than what was seen in 2022 when the outbreak all began, where they saw like 200 cases in a month, there's definitely an uptick going on. And it's highly, and health officials from Public Health Seattle and King County, you're saying, well, if you're eligible to get vaccinated against Mpox, you should. And King County health officials associate most of the Mpox cases with sexual or intimate contact among gay, bisexual, and other men who have sex with men, transgender people, and non-binary people. So they are recommended the following people get the 2 doses of Mpox vaccine, and that's individuals who have had skin-to-skin contact or other close contact with someone who had Mpox, gay, bisexual, and other men who have sex with men, etc., and individuals who have engaged in commercial or transactional sex in the past 6 months. So prostitution, for example. So that's something that's going on up in the Seattle, Washington area. Now, if we go from the far northwest to the far northeast, the state of Maine, they are reporting an increase in Lyme, anaplasmosis, babesiosis, other tick-borne diseases so far in 2025 as compared to last year. The Lyme disease count is already at 3,565. That's up about 300 cases from the same time last year. And they're also reporting other types of tick-borne diseases: hard tick relapsing fever, tularemia. They had 1 Powassan virus case and several others. So the Maine CDC, the Maine Centers for Disease Control, recommends the following steps to limit exposure to ticks. And that's to take and use EPA-approved repellent. That includes DEET and several others. Inspect your whole body for ticks daily after any outdoor activities, including family members, including pets. And when it says check your whole body, it means your whole body, every little crevice. Know where the tick habitats are, and take the necessary precautions. Cover your skin with light-colored long-sleeve shirts and pants. Tuck your pants into socks. And shower when you get home. This will help remove the ticks. Put clothes in a dryer on high heat for 15 minutes before washing to kill the ticks in your clothes. So Maine is seeing increases in Lyme disease, anaplasmosis, and babesiosis, and hard tick relapsing fever. So, okay. One of the bigger stories that I've been covering basically on a daily basis is out of the West African country of Senegal. And they have an outbreak of Rift Valley fever. And it's been expanding and growing pretty rapidly since the outbreak began, since the first cases in September. And yesterday I reported that the case count is now up to 302, and it's now spread in 8 different regions, with the St. Louis region being the region with the most cases. It's where it all started. It's kind of the epicenter, right? And also 26 fatalities have been reported up to this point. So yeah, we're keeping a close eye on what's going on in Senegal. And the country that's right above it is Mauritania, and they are also being hit with a Rift Valley fever outbreak. I'm not sure exactly if this is most primarily tick-borne, or is it primarily exposure to animals, but 300 cases in about a month, it's quite shocking. And so we'll keep an eye on what's going on in Senegal, as we have been the whole time. Let's see, cholera in the Democratic Republic of the Congo. This is a report we did a few days ago. And from January to mid-October, they're saying that the epidemic is of alarming intensity. Who's saying that? Doctors Without Borders is saying that, and they're on the ground there treating people for cholera. In the Democratic Republic of the Congo, which has a number of different outbreaks going on at any one time, so far have seen 58,000 suspected cases in 9 months. And this is out of 20 of the country's 26 provinces. And more than 1,700 fatalities have been recorded. And that's about a 3% case fatality rate, which is high for cholera. And the situation seems to be getting worse, and it's spreading to new health zones and provinces which have not seen or are not endemic for cholera. There's a lot of things going on there at the DRC. There's the flooding, and there's conflict and displacement of groups, and inadequate sanitation, which results in, tainted water, and a rainy season that's not helping the water situation. So big problem in the DRC, but it's not just the DRC. Africa alone, since the beginning of the year, has reported over 280,000 total cases, suspected, probable, and confirmed, and nearly 6,500 fatalities from 23 different countries. So, yeah, big problem in Africa this year, as it was last year, with cholera. Let's go down to South America, and a report we did 2 days ago out of Peru. And the Ministry of Health in Peru has reported an outbreak of 6 cases of human cutaneous anthrax in the province of Cañete. And I think that's near Lima. And these are people who they suspect had contact with sick animals. All the people, there was no fatalities as far as I know. All the people were treated promptly and appropriately. So right now they're taking such actions like searching for more anthrax cases, vaccinating all the susceptible animals, clinical evaluation of those working in the affected stables, and trying to find people and get them treated in a timely manner, because anthrax can be a very lethal infection. And of course, these are all cutaneous infections. And I did have the picture. Here's a picture of an anthrax sore. So anyway, so we'll be keeping an eye on that. I suspect, though, anthrax is not uncommon in Peru, so I suspect that'll be under control pretty quickly. If you didn't get a chance to, did a couple podcasts in the past week. One was about soil transmitted helminths. Those are roundworms, Ascaris, trichiurus, hookworms, and strongyloides that you get via the soil, whether you ingest it or skin penetration of the larva. And I had a nice talk with Mercy. She's a parasitologist from Nigeria and has good expertise on soil transmitted helminths and neglected tropical diseases. So if you get a chance to check that out, you can find that here on the YouTube channel. So I encourage you to check that out. Mercy did a great job. Hong Kong reported its first chikungunya death. It was an older individual with multiple problems. So Hong Kong's seen about 43, 44 chikungunya cases so far. They're all imported, and they're mostly like travel to Guangdong, China, where they had that big outbreak. I did a story about the hepatitis A outbreak in the Czech Republic in Europe, and the cases continue to go up. It's up to over 1,800 cases now and 21 fatalities, and 40% plus are out of the capital city of Prague. So that's something we're going to be keeping an eye out on. Here's a spokesperson for the Prague Hygiene Station, and they said, in Prague, we are already talking about a local epidemic, and the rising number of infections is beginning to spill over into other regions. So yes, it's really important to pay attention to this situation. So good hygiene, right, and vaccination for hepatitis A are the best ways to prevent hepatitis A. Okay, let me see. Let me go down. Oh, another podcast I did in the past week, chikungunya in New York. A week or so ago, we reported on the first locally transmitted chikungunya case. This is a mosquito-borne virus in Nassau County in Long Island in New York. And first one ever, and it's the first locally transmitted case in the U.S. in 6 years. I think the last time there was one was down here in Florida. And I got the chance to speak to Dr. Eileen Chang with George Washington University. She's an associate professor of medicine. So I encourage you to check that out. Another very good interview with somebody who knows a lot about chikungunya. Let's see. What else happened in the past week? We looked at South Carolina's measles outbreak in the upstate, up near Spartanburg County. I think the case count up there is now about 25 confirmed cases. We looked at the dengue outbreak in Samoa. Let's take a little bit closer look. We've been watching this outbreak the most of the year because it's really been quite significant. Remember, Samoa is just this little set of islands out in the Pacific, and they've had over about almost 4,400 lab confirmed cases since January, and about 15,000 clinically diagnosed dengue cases since the beginning of the year. 3 out of 4 cases are in children. Dengue virus 1 is the serotype found in 9 out of 10 cases. And I think there's been some fatality. I think there's been 7 fatalities in this outbreak too. So, yeah, so that's been kind of a big story out in the Pacific, in Samoa, dengue fever in the Pacific. Here's an important story right here. At the beginning of the week, we reported on the 30th wild polio virus type 1 case in Pakistan in 2025. And this was another one from KP province. I'll try to pronounce it. Khyber Pakhtunkhwa. That's the province. And it was a 12-year-old boy from Torkar, and that's the 30th case. 19 out of the 30 cases have been from KP, 9 from Sindh province, and 1 each from Punjab and Gilgit-Baltistan. Not so good at pronouncing some of these names, but anyway, but Pakistan just had this massive polio vaccination campaign, and the 4th one of the year, and they vaccinated over 44 million children, and pretty impressive numbers. So hopefully things improve there. I think Pakistan has 30 wild polio virus cases, and I think Afghanistan, the other polio endemic country, has 9 so far. So there's 39 globally. This is a disease that we've been thinking for a while would be eradicated, joining the likes of smallpox, but it keeps creeping up. But we have seen some amazing things over the years, right? I remember, I don't know, mid-2000s, India used to report 150,000 polio cases a year. By 2011, the number was 0. They did a massive vaccination campaign. And as of today, 2011 is 14 years, not another polio case. So that's pretty impressive. So it's definitely possible. Nigeria, a couple years ago, was removed from being an endemic country. So right now it's just Afghanistan and Pakistan. And okay, here in the state of Florida, we reported our 50th locally transmitted dengue fever case. 34 of these have been in Brevard County, which is several counties north of where we normally see this stuff. So it's more on the east central coast of the state. And last year there was no dengue in Brevard County. Trying to think what cities there. I think it's Melbourne and Palm Bay. So it's definitely quite a bit north from Miami-Dade and Broward, where you typically see this stuff. So yeah, so that's raising some concern. And I guess the last thing I'm going to go over is this. This is some good news. This was last Sunday, reported this. The World Health Organization said that the last Ebola patient in the DRC, Democratic Republic of the Congo, was discharged, and there's been no new cases reported since September 25. So they're on the countdown, the 42-day countdown until the outbreak can be declared over. So if no new cases are detected, the outbreak will be declared over in early December 2025. So we'll be keeping a close eye on that. This outbreak, which was found in Kasai province in the Bolapi health zone, saw 53 confirmed cases, 11 probable cases, and don't remember the fatalities, but the case fatality rate was reasonably high. Anyway, so the Democratic Republic of the Congo, we're going to be keeping an eye on and counting the clock down on the Ebola outbreak and waiting for the day that we can declare this outbreak over. All right, well, and that's basically what we saw at Outbreak News Today, the website, over the course of the past week. There was other stories, but those are some of the bigger ones. I encourage you to check out the website. That's at outbreaknewstoday.substack.com. Subscribe to it. If you feel like doing a paid subscription, please, we're always willing to take the help, and encourage people to check it out if you're interested in news about these outbreaks, infectious diseases, information, and podcasts that are posted every week on Outbreak News Today. And I appreciate you watching today, and I'll see you next time on Outbreak News TV.